Hi, this is Angie Harrison, and I'm a graduate student working to become a family nurse practitioner. I have kindly been granted permission to do my doctoral project at Genesis Clinic, and this is part of my project. I realize your time is very valuable, and I thank you for taking the time to view this. The objectives for this lecture include: describe the significance of prediabetes in our nation, identify barriers to prediabetes screening and patient education, identify risk factors of people who are likely to have prediabetes, describe the CDC prediabetes screening test, discuss the do's and don'ts in prediabetes patient education, review a script for having an initial discussion with patients about prediabetes, and explain the prediabetes quality improvement project for Genesis. Most of you are aware that diabetes is epidemic in this nation. What you may not realize is that there are an estimated 84 million additional people who have prediabetes. This is an alarming number. Even more alarming, I think, is the fact that a staggering 90% of these people are unaware they have the condition, even though research shows that people who are aware of their condition are more likely to make the necessary long-term lifestyle changes that can help delay or prevent the onset of type 2 diabetes. So it is identifiable and preventable, yet we're not telling people about it. To prevent a progression from prediabetes to diabetes, we need to be better about screening, identifying, and educating. And my DNP project is an attempt to do just that. Research shows that patients are not getting evidence-based practice recommendations from their primary care providers for prevention, and there are several reasons for this. Time demands of adding on one more screening test are a reality. Lack of knowledge on how to counsel patients about lifestyle choices is another issue. PCPs themselves do not make healthy lifestyle choices, may feel uncomfortable recommending patients do so. And lastly, not knowing all the risk factors is not uncommon. So let's talk about some of these risks. Several national healthcare organizations have suggested guidelines for prediabetes screening. The ADA and CDC both recommend screening for adults who are overweight or obese and older than the age of 45. The United States Preventative Services Task Force recommends screening for people between the age of 40 to 75 who are overweight or obese, and the AACE recommends annual screening for patients with 2 or more risk factors, and they include all of those listed here. There's a lot. A couple of real interesting ones I thought were the night shift under sleep disorders and antipsychotic therapy for schizophrenia or severe bipolar disease. So let's talk about the screening. This can be done through 3 recommended blood testing methods to identify or diagnose prediabetes: hemoglobin A1C, fasting plasma glucose, and the 2-hour post 75-gram oral glucose challenge. These tests, however, are invasive and costly. There is a much simpler and faster way to determine if a person is at high risk of having prediabetes. It doesn't confirm a diagnosis. That would need to be done with one of the blood tests, but it identifies people who are likely to have it, and it opens the door to a discussion on how to prevent or delay a diagnosis of diabetes. The test I'm referring to was created by the CDC. It's a paper risk assessment test that is inexpensive, quick, and easy to utilize. It can be offered to anybody with any of the risk factors, and it takes less than 1 minute to complete and can be done in the waiting room. So this is what the test looks like. It's kind of hard to read on the screen, but you'll get a full-size copy in your email, and these will, of course, be at the clinic. So 7 questions kind of related to family history, age and weight, and history of having a large baby. So the CDC screening test can help open the door to discussion on lifestyle changes. Let's now talk about patient education, the next step. We need to inform patients with scores of 9 or greater than 9 that they are at high risk of having prediabetes. We should explain what diabetes is and how prediabetes is different. We should explain the consequent risks if it progresses to diabetes. We need to educate patients about risk management and provide tips for healthy lifestyle choices. The NIH and CDC developed a national diabetes prevention program known as the NDDP, which you might all be aware of. And in that program, there are a list of do's and don'ts for the initial conversation with patients who have prediabetes. So I'll read through these quickly. Don't use the term, or do use the term prediabetes. Don't use the terms borderline diabetes, touch of sugar, or just say their sugar's a little high. So an emphasis on the word prediabetes. Do emphasize the significance of having prediabetes, explain how it's different than type 2, and offer hope for preventing or delaying the diagnosis of type 2. And don't assume all patients will understand this message in the same way. You all know that. Do tell the patient that having prediabetes means he or she has a much higher chance of developing type 2 in the coming years. Don't tell them it's just something to keep an eye on or monitor at the next visit. Do expect that people can change their behaviors no matter where they start. Do not have preconceived ideas about a person's success in changing. So we talked about barriers, risk factors, and some do's and don'ts. Now the good news, this is the best part. As a provider, you can tell these patients they can prevent or at least delay the progression to diabetes by moving more and eating better. So here's a script for talking with patients about prediabetes. I'll read through this quickly. Thank you for taking the prediabetes risk assessment test. Your score of 9 or higher tells me you're at high risk of having prediabetes, and as your healthcare provider, I want to help you be the healthiest version of you possible. So I'd like to spend a few minutes telling you about the condition and give you some ideas on how to prevent or delay diabetes. Prediabetes means your blood sugar is higher than a healthy level, but not high enough to diagnose you with diabetes. To help you understand diabetes, you need to know that sugar comes from food and gets absorbed into your blood to be used for fuel. Insulin is a hormone made in the body by the pancreas. It's needed to bring the sugar you eat from the blood into your cells for fuel. Diabetes occurs when the body doesn't make enough insulin or when insulin doesn't work well enough at getting sugar out of the blood. There are risk factors that cause diabetes. Some involve things we cannot control, like genetics or the things that we inherit, and some involve things we can control, like how much we move and the food we eat. The more sugar or carbohydrates you eat, the more insulin your pancreas has to make. Eventually, it gets tired and can't make enough insulin, so too much sugar remains in your blood. This could put you at risk of stroke, blindness, nerve damage, and kidney disease. But believe it or not, I am here to tell you some good news. You can lower your risks by eating better and exercising more. And big changes are not necessary. You just need to take small steps to eat healthy, be active, and lose weight. And here are some tips on how to do that. Avoid or cut back on drinking juice and soda. Drink water instead. Eat less carbs. Carbs in food turn to sugar in the body. Examples of carbs are sweets, pasta, rice, beans, fruits, and even some vegetables like corn and carrots. Eat smaller portions of food. Divide your plate into 3 sections. Try to fill 1/2 with vegetables, 1/2 with protein like chicken or beef and fish, and 1/4 with a starch like a 1/4 cup of rice or potato. And choose fruit for dessert rather than cookies, pies, or cakes. Eggs are great. Try 2 in the morning for a great source of protein without any carbs. Move more. Walk briskly, 30 minutes a day, 5 days a week. Just walk for 15 minutes, turn around, and walk back. Or split the 30 minutes into 3 10-minute walks. Losing 5 to 7% of your weight may prevent your risk of diabetes. So a person who weighs 200 pounds only needs to lose 10 to 14 pounds. And weight loss is a marathon, not a sprint. It can take up to a year to lose that amount, but it can greatly improve your health. Changing our habits is hard. Just try your best. If you have a day where you eat poorly, just try to eat better the next day. Change is a process that takes time. You can start with one change at a time. What change to your eating or physical activity habits do you think you can make starting today? So to recap, we need to screen, identify, and educate. There is evidence of the value to screening and providing risk management education, yet this practice is not being followed in primary care practice, including here at Genesis. Patients are not screened and identified for being at high risk, and they are not introduced to lifestyle changes to mitigate the risks. I would like to see that change. I personally would want to be informed if I was at high risk of developing diabetes, and I want to give our patients that opportunity. Research shows that identifying patients and talking to them about their risk elevates the importance to them of lifestyle behavior changes. I realize I am not naive. I have spent enough time with patients to realize that knowing about risk factors and healthy lifestyle choices does not guarantee changes in their behaviors. I know we do not have control over what patients do with the information we give them. It's far more complicated than that. I do know, however, that people at high risk deserve to know that and to learn what to do to minimize those risks. Screening, identifying, and educating is something we can control. My D&P Quality Improvement Project is an attempt to do this. So now an overview of the project. This process will look something like this. Patients seen on Tuesday nights with a BMI of or greater than 25 and an age of or greater than 45 years will be identified by myself via a quick chart check. These patients will be asked to complete the CDC prediabetes screening test in the waiting room after they complete the PHQ-9 and GAD-7 tests. The test will be turned into the front desk along with the GAD and PHQ-9 tests. The RN will record the scores in the notes section of the vital sign intake page. The RN will also verbally report the score to the provider, to you, when giving the patient report. The provider will then inform the patient of the score and provide education to those with a score of or greater than 9. The front desk staff will provide the patient with prediabetes information handout to take home when the patient checks out. The provider will document prediabetes diagnosis and education provided. There will be sheets taped to the clinic desk reminding you of this process, so don't worry about remembering it. And I'm going to be there every night, every Tuesday night through December. 1 month after the patient is seen by you, I'll call them and do a telephone survey to indicate if they appreciated the information and if they made any lifestyle changes as a result. And at the close of the project in December, providers will be asked, I'll be asking you to take the survey that you've already taken once again to assess for any changes in prediabetes screening and patient education practices. So in summary, prediabetes is an asymptomatic condition that's highly prevalent and easy to detect. There's evidence of the value of screening people for prediabetes and providing risk management education. Screening for prediabetes should therefore be a priority. GCH is the primary source of health care for its patients, yet patients with risk factors for prediabetes are not screened and are therefore unaware of the significance of improving their health. These patients should be introduced to lifestyle changes targeting physical activity and weight loss to prevent or delay a progression to diabetes. This is an issue at Genesis and throughout the United States. The ADA, AMA, and CDC are all working on a campaign called Do I Have Prediabetes? To tackle the national crises. The campaign includes a public service announcement that encourages people to take the screening test online. To aid in this effort at Genesis, let's make it a priority to screen, identify, educate, and inspire our patients to take action to prevent a diagnosis of diabetes. Successful adherence to the use of a prediabetes screening tool by PCPs can lead to risk management education, help curb the epidemic of diabetes, and most importantly, help our patients take care of their health and avoid the morbidity and mortality linked to diabetes. Thanks again for viewing this video.